Hi, my name is Carl Reed. I'm going to be your therapist today, and thank you for coming in. You can feel free to call me Carl if you like, if that's comfortable to you. But you're Persian, correct?
Yes, I am.
Okay. And then, as I understand your culture, and I don't understand a whole lot of your culture, but as I understand some of your culture, speaking informally to somebody you barely know, or especially somebody that may be in a kind of a professional setting, may not be comfortable for you to use first names.
Sure.
Okay.
Yeah. Usually in my culture,
Mhm.
we call people with their family name,
Mhm.
not the first name.
So would you prefer to call me?
Yeah. Can I call you with your family name?
Sure.
And you too?
So would you like me to call you Ms. Grandpaes?
Yes, please.
Absolutely, I would be glad to do that.
Okay. Thank you so much.
Absolutely. So Ms. Grandpaes, before we get started today, I want to talk to you a little bit about confidentiality. And confidentiality basically means that everything you and I say stays within you and I. I want to make sure that our therapy is always a safe, comfortable environment for you to be able to express whatever feelings you have. And so just know that whatever you're going to say stays between us with a couple small exceptions, okay? And the exceptions are this. I am because of ethical standards, and I am a mandated reporter for the state of California. Anytime I feel that there may be an imminent harm for you or you causing harm to somebody else, I need to report that. Also, I would need to report something if you said there was a harm being done to a child or an elderly person. Okay. And the only other time I would have to share our information would be if I was ordered by the courts in a subpoena, or they, directly subpoenaed me for all my medical records. Okay. Other than that, everything's always just going to be kept between you and I. Is that okay?
Yeah.
All right, fantastic. So, from what I understand from the intake assessment, that you're having some worries or anxieties right now about your job.
Yes, that's correct. I work in a hair salon, and also I have my clients, and I am packed. But unfortunately, my manager wants me to see more clients.
Mhm.
And because I work with scissors and chemicals usually, and my client safety is priority, even for the company. So sometimes I focus more, and I am not fast enough for them. And this is why she most of the time trying to push me to work faster.
So just to try to understand so far, what you're saying is when you're at work, your manager is pushing you to put more clients. Is that a company quota thing, or is that something that she's just pushing you on?
No, this is a quota.
Quota? Okay.
Quota.
Okay. So this is not something your manager's doing because it's personal to you, but it's more because of what the company says has to be done.
No, it's a quota.
Yeah. Okay. So what the company has to do. Okay,
yeah.
Great. Okay. Just trying to understand that. Thank you. So because of this quota being put on you, it's what I understand is causing you to have worry and anxieties at your job. Right?
My anxiety also has an impact. It impacts my work, and it makes me slower.
Okay.
Something is, I can say it's kind of weird or strange that when my manager is not there, I I hit the quota. But when she is there, my anxiety is so high. So yeah, I can work as much as I.
And she's doing this just to you, or is this with everybody in the salon?
She usually do this to most of the other stylists, but because I am kind of new there, and I am learning more about the rules and regulations.
So you don't think this is personal that she's doing it?
No,
it's just
not
she's just
personal.
doing her job.
Yeah.
Okay. So then the problem really isn't your manager as much as the quota is causing her to push you, which means that's causing you to have the anxiety and the worry about getting the job done. But let me ask you this. Have you been able to make those kind of quotas? Have you been able to meet the number of clients or make the money that you're supposed to make every week? Has that been something you've been able to do in the past?
Yes, it happens to me, but unfortunately, usually when my manager is not, or she's out working.
Okay. Because that reminds you that anxiety is there and that pressure is there.
Yeah, because some part of my brain is just looking at her, it's kind of scared or afraid
I
of,
understand.
what I
Right.
mean.
So I think what I'd like to do is this. What I'd like to try to do is I'd like to try to separate that worry and anxiety from you.
Mhm.
So Ms. Rampaye is you. Worry and anxiety is keeping you from getting the quota done because you're always so focused on that. It's kind of causing the stress and anxiety. What if we were to find a way to kind of take that and separate it from you? In other words, don't let it be who you are, but just be an issue that we have to deal with separately from you. Does that sound like something okay?
Um, it sounds okay, but I never have done this before, so
It's always because it's always kind of been
Yeah.
within you. I
Yeah.
understand. So let me ask you this. You've already told me that you had successes in the past. That's not a problem. But if we were to separate this out and kind of almost personify it, make it like a person kind of thing, have you ever had problems in the past with people that, either influenced you negatively or treated you poorly? And if so, how did you react to those people?
usually, I try to neglect them, or I trying to stop seeing them, talking to them, or stop relationship, any kind of relationship I have with them. But yeah,
So you would just kind of cut them out of your life a little bit?
yeah,
Okay.
correct.
Okay. So what if we were to take the anxiety and the worry and treat it like as a person that's like they're trying to treat you bad? Like let's say, for example, we'll call him George. Okay?
Okay.
So if your worry and anxiety is George,
Okay.
and George keeps, every time your boss shows up, George shows up with your boss.
Okay.
Right? Because you said it's not your boss, right? It's just her job, right? But
Yeah.
it's a company. But George is that person that comes in with your boss all the time that stands there and makes you worried and anxious because now you can't think about, you're worried about your client safety that you can't, get the job done fast enough. But you've been able to do it in the past when your boss is not there because when your boss is not there, George is not there, right?
Yeah.
So-
That's correct.
So let's treat George as a separate entity here.
Okay.
And let's find a way to try to treat George the same way you would treat somebody else that you'd had the problems with in the past. So you talked about finding ways to ignore them or block them from your life, correct?
Yeah. Correct.
So what if we were to take George, every time your manager shows up and you know George is coming with her,
Okay.
you're just going to say, George, I'm going to block you from my life because you're a negative influence on me. I'm not worried about you, George. I'm just going to focus on my job because I know that I'm good at what I do.
Okay, but it's a kind of weird strange to me. I know.
I'm sure it is. Anytime we kind of think about these things in a separate way, they're always a little strange and weird to us. But what I'd like to know is, would you be willing to try that for a while?
Yes, sure.
Okay. So we're going to, every time your boss shows up,
Okay.
you know George is coming with your boss.
Okay.
Okay. And so I want you to go and say, George, you're not a part of my life today. I'm blocking you. You're a negative influence. So we're going to basically treat George the way you treated people in the past as far as being negative on you. Okay?
Okay.
You think you could try that for about 1 week or so?
I can, but I don't promise that I
Of
will
course.
be successful.
Of
But
course.
I will.
I understand. Well, the only thing I can do is ask you to try. And then what I can do is get together again next week. And we can
Okay.
kind of discuss about the things that worked well for you, how you were able to block George or not.
Okay.
And then if we need to, we can talk about a few more strategies, how we can make that more effective for you so that you can continue not having these anxieties and these worries and still accomplish the things that you know that you can already do.
Okay, let's try it.
Great. Thank you, Ms. Grandpike, for coming in today. We'll reschedule for next week, okay?
Thank you so much.
Thank you.
Have a good day.
Thanks, you too. Bye-bye.
Bye-bye.